Well, welcome everyone to already the last two presentations of our very interesting AFINet conference so far. My name is Doreen van Amen. I live and work in the Netherlands, in Rotterdam, at Rotterdam University of Applied Sciences, and hopefully will host next live conference. So fingers crossed that we'll see each other live in Rotterdam next year. We have only 40 minutes for two presentations coming up and for some questions, so I'll be brief. And I have to time manage very strictly. Speakers have 15 minutes each, and we have 5 minutes for discussion or for questions. So I'll introduce the first speaker to you. Janina Dyba from the Catholic University of Applied Sciences in Köln, and from the German Institute of Addiction and Prevention Research. She will talk about parental illicit substance use in Germany. Well, you know the drill already. You can put your questions in the chat. And the floor is yours, Janina.
Thank you very much. I hope you can see and hear me, and I'm going to try to share my presentation with you. Which I cannot. Can somebody else share it, maybe?
Nina, do you want to have a go?
Yeah, yes, I have the
perfect. Thank you. I'm so sorry.
It's
No
okay.
worries.
Having various of these problems, as you may have noticed. Things always work when you try them out beforehand.
And we cannot see you, Janina.
You cannot see me? Okay, that's weird because I can see myself.
Oh, I cannot see you.
I can't see you either. Mina's sharing the presentation, but
okay, can you not see me?
Picture. No, but don't worry too much about it as we got the presentation. But if you want to, I have no idea what to do to get you.
Well, probably the best way would be if I leave quickly and join the conference back, because I could not see you. And I just talked to Diana and she said she could see you and I could not.
Okay. So
I'm just going to leave quickly and come back in a second.
Okay, Janina, let's do so. And you can see the slides, okay?
Yes, we can see the slides very well.
Okay. Well,
can you see me now?
Ah, yes, we can see you now. Yes,
perfect.
Yes,
Hi.
Hello, Janina.
Hi. Well, thank you very much for the opportunity to present at the conference today. And as you already introduced, I'm going to talk about parental illicit substance use in Germany, give a little insight on our research project we did, and I'm going to present the baseline data on parenting stress and approaches to intervention within these families. And my colleague Diana, in the second presentation, is going to talk about the intervention part a little more. So I cannot. Yes, thank you very much. I'm going to keep the background really brief because of the limited time and probably the expertise many of you have in concern for substance-affected families. We're talking about disadvantageous living situation within the families, especially for children. So we have unfavorable socioeconomic situations, risk for violence within the family, risk for stigmatization of children and all family members, and large numbers of children that live in discontinuous relationships with their parents through out-of-home placement or parental separation. And when we come to illicit substances, the situation tends to be even more precarious because we have high rates of both parents using substances and a high frequency of psychiatric comorbidities, again, in both parents. And of course, children might be exposed to the drug-associated subculture and the associated social marginalization that comes with it. So if you could click, there should be a, Yes, so we need to, nope, back, sorry. Yeah, there's a need to investigate the specific support needs, of course, of drug-using parents in Germany, and we wanted to see what challenges them in their parental role and foster for them to take over responsibility in their role. So since we explore families with young children, of course, our goal is to enhance the living situation of the entire family and, of course, children involved. Next slide would be great. Thank you. So the profile of our research project is called Shift Plus. You might have heard about the Shift Parent Training. I think Janina presented it already at the AFINet conference, which was a training for methamphetamine-involved parents, and we adapted it. So Shift Plus is an adaptation and actually extension of the Shift Parent Training for all parents involved with illicit substances, and not just methamphetamine-using parents. And it lasted until June this year, started in 2018, and was funded by the German Federal Ministry of Health. And Michael Klein was the leading investigator, and Diana and myself worked as scientific staff on the project. Next slide. Thank you. So Shift Plus targets drug-using parents with children aged up to 8 years. We chose this age span because we have support interventions for children older than 8 years in Germany, but we have no or hardly any interventions targeting families with younger children. And since younger children have a hard time getting support for themselves, it was our idea to target the parents, of course. And we included both mothers and fathers, expecting parents who did not have a child yet, if they were interested, abstinent parents with a maximum of 2 years, and currently using parents as well. We included parents using multiple substances as long as an illicit substance was the primarily used drug, and parents whose children were currently placed outside the home if frequent contact was present, because this is very common within these families, of course. So it was not our intention to exclude these parents, but if there was no contact given, it might have been really stressful for parents to participate, because it was about parenting practices and building relationships. So we thought that at least monthly contact would be good for them to participate. Next slide. Thank you. So I'm going to present the research questions. So if you just could click through, it was actually nicely animated. 2 more, yeah. So the research questions of my presentation are: how does dysfunctional parenting and parenting stress manifest in drug-using parents? What predicts parenting stress in the target group? And what substance-specific differences can be observed? Since we had a mixed group of substance-using parents, we looked for substance-specific differences. And I'm going to come back to those within the presentation. Thank you. Next slide, please. We recruited parents who were interested and eligible for participating in a parenting intervention, and we performed it through substance use and child welfare services across Germany. And we had the data I'm presenting is the baseline data, so it was a written paper pencil assessment, and we conducted it prior to the COVID-19 pandemic. So it does not reflect the situation of these families maybe during the pandemic or even after, but we would assume the situation is more precarious now. We use standardized assessment tools to assess substance use, parenting stress, psychological problems, parenting practices, and children's psychosocial problems, as well as family resilience. And we did a series of analyses, both descriptive and also multiple regression analysis and group comparisons. Next slide. Thank you. Okay, this is our sample. I'm just going to keep this brief. Looks a little weird, but hope you can see it. Well, most of our participants were female, so we have about 75% female participants. Overall, we had 87 parents recruited, which was a fairly large number for parents using illicit drugs. The mean age was 32, and as for the relationship, most of them were in a relationship, but hardly any were married, as you can see. And we also gathered information of 170 children, of which about half were placed outside the home, and 29% of parents had no children living with them currently. So all children were placed outside the home. We had half of children living outside the home and 1/3 parents without any children. And the main substances used were multiple substances, cannabis, methamphetamine, opiates, and amphetamines, others, and MDMA were not as many within our sample. And the substance use severity showed that most of them had problematic drug use or were drug dependent, and only a little proportion had no substance use issues anymore. Next slide. Thank you. Okay, and back to my first research question, how does parenting stress manifest? So if you could click twice again, there should be a little nice animation, because this is a large figure, I know that. Yeah, exactly. Thank you. For the parenting stress, you see all the subscales of the parenting stress index, and we compared to standardized norms for mothers, at least, because there are none for fathers, sadly. But you can see the more red, the less green, the more problematic was the subscale. So parenting stress was pronounced in terms of depression, which means depressive perceptions of parenthood, a feeling of lacking competence in child rearing, and social isolation. And on the right, you see dysfunctional parenting, and it was quite interesting. We had a parenting scale used that differentiated overreactive parenting tendencies and lax parenting tendencies. And in this sample, we had a large proportion of parents tending towards laxness, which means like high permissiveness and no setting boundaries. And in the other sample we had where we had methamphetamine using parents, we had stronger tendencies towards overreaction. So we assumed there might be a substance use specificity. Okay, thank you. Next slide. Psychological problems of parents and children. If you could click again a couple times, you could see what is interesting here. Exactly, you see, oh, perfect. Thank you. On the left, you see parental psychological problems. About half of parents scored in terms of all the subscales we use: paranoia, depression, anxiety, aggression, and psychoticism above average. And with the psychosocial situation of the children, we see a lot of children with conduct problems and a large overall burden for the children. So 20% with a very high number in psychosocial problems in the children. Thanks. Next slide. Okay, what predicts parenting stress was my second research question, if you remember. And I know this is not a very nice table, but it is a regression table. And if you could click a couple times, you can see, yeah, what our significant predictors are for the parenting stress. We looked at sociodemographic variables, age and gender, substance use, psychological problems, and family resilience as predictors. And you see on the right that the significant predictors were children's age, children's gender, parental psychological problems, and family resilience. So altogether, it is parenting stress was significantly predicted by children's older age. So parents with older children were more stressed. Mothers and fathers of boys were more stressed, was male gender. Mothers and fathers that had psychological problems and reported low resilience in the family. Those were those that were stressed more than the others. Thank you. Next slide. And with the substance-specific differences, we did group comparisons between, we had to group the substances so we could get kind of even groups, and we had cannabis, opiates, stimulants, or multiple substances, because they were at least fairly close, the numbers. And we did group comparisons and found no statistically significant differences. I have to say, though, that the groups are still fairly small. So if you could click, I think one result was, I don't know, it doesn't matter. We had,
Janina,
no problem, it's good. Okay, you see for the dysfunctional parenting, we had stronger tendencies in parents using opiates than in those using cannabis. Okay, next slide. Well, the results overall on the parenting situation of drug-using parents in Germany, they exhibit pronounced parenting stress with regard to depression, social isolation, and perceived lack of competence. They experience psychological problems, especially in terms of depression, anxiety, or paranoia. And High levels of parenting stress are predicted by comorbid parental psychopathology and low resilience in the family, as well as the children's characteristics. And we have heightened permissiveness within these parenting situations. And we have problematic situation of children involved and could not observe substance-specific differences. One limitation I said already was the small sample with regard to the group comparisons, but we also recruited, of course, through help services. So we cannot give any information on untreated parents. And we also relied on self-report measures. And to measure family resilience, there's no standardized tool available. So there's still room to develop. Okay, next slide. I think that will be my last one. Yeah, what does this imply? The need for systematic support, of course, for parents involved with drug use and their children. And I like to focus on the high demands these parents experience and the perceived low competence. And this can result in a really problematic overstrain and potentially dysfunctional coping through substance use. So interdisciplinary support would be very good for these parents, including mental health and child welfare, as well as substance use treatment. And due to the depressive perception of the parenthood, a research-oriented approach appears appropriate, and to foster resilience within the families. And the practical parenting training might include strategies to establish boundaries and enforce them calmly, consequently, and of course, non-violently. And a group setting appears appropriate since parents reported large numbers of social isolation. And our results imply that a group setting might be appropriate for parents using illicit substances in general, regardless of the primary use substance. Okay, there's, I think, one more click. Need necessary, yeah. So I'm happy to hear about your questions. Thank you.
So I see no questions yet.
No problem.
I have a question for you, but we can also go to the talk of Diana Meusken right now.
Yeah, we can go first. Yeah, sure.
And then we have questions for the both of you at the end of her. Is that okay with you?
That's a wonderful idea.
Is that okay with you, Diana?
So I'm still muted. Do you hear me? Can you hear me now?
Yeah.
Okay, great. Yes,
okay,
sure.
So I present the second speaker to you, Diana Meusken. She's from the Catholic University of Applied Sciences in Paderborn, and she will talk about Shift Plus parent training and intervention for mothers and fathers using illicit drugs. So the floor is yours.
Yes, thank you, Doreen. Thank you, everyone, for having me. I'm really glad to see you again, even if it's online only. I'm trying to share my screen. Let me see if it works. Yeah, seems so. Mm-hmm.
Yes, that's working. Okay,
that's fine. I don't see my presentation when I return to Teams, which is odd. Okay.
Well, we've got your screen, and it's not in presentation view. It's with the slides on the left as well as.
Yeah, I know.
We can see it.
Okay, that's good.
How you'll click through it if you can't see it.
Okay, I don't see my presentation. So maybe
Diana, do you want me to? Yes, I can again.
Yeah, that would be great. I think that's easier before I try now a couple of times.
You can see it?
Yes, perfect. Thank you. So my presentation on the Shift Plus parent training, which is an intervention for mothers and fathers using illicit drugs, actually builds on what Janina just said. And Yes, we were both working in this project, and this is an overview of my presentation. I'm giving a very, very brief background on the presentation, and then I'm going to present the contents of the Shift Plus intervention. I am then telling you about the research method we were using to evaluate this training, and then I'm going to present a brief summary of the results we found, and then I'll have 1 or 2 discussion slides. Okay, thank you. Next. Okay, this is something you already know because Janina just mentioned it. It is based on an original Shift parent training. The Shift parent training in its original version is a group intervention for mothers and fathers that were using only methamphetamines, and they were having children up to 8 years of age. And the focus or the goal of the Shift parent training was to strengthen parenting skills and family resilience, and also to stabilize abstinence. And Shift Plus actually has the same goals, but as Janina already said, it addresses parents using other illicit drugs as well, such as opiates, cannabis, stimulants, or polydrug use. So this was an enlargement of the original Shift parent training. And we also added 2 modules in this Shift Plus training. We have integrated 2 family modules. One was for partners or other adult relatives or adult family members, and 1 module was for their children. Okay, thank you. Next slide. Yes, the Shift parent training, Shift Plus parent training, Janina said this, so I think I'm going to skip this slide. You know already the target group was for parents with children up to 8 years of age using illicit drugs. Janina already told you the details. And this is what I'm to put my focus on is the contents and the form of the Shift Plus intervention. It's also like the Shift original training, a structured modularized group intervention for mothers and fathers using illicit drugs with children up to 8 years. It contains 10 modules, including the 2 family modules, and each module lasted 90 minutes. And this already said, it's one for it's 2 family modules integrated, 1 for adult family members and 1 for children. And what we were trying to achieve, that each module is led by 2 trainers, and ideally 1 comes from a substance abuse treatment facility and 1 comes from a child welfare institution, so that we can combine those 2 expertises. Thank you. Next. Next slide, please. Okay, I do not see the next slide. I don't know. How about you?
No, it hasn't moved.
It's in the 8th slide for me.
Oh no, it's
not,
I don't
not for us, Mina. We're still on 6.
Okay, it's jammed. You see?
It's still on 6.
Okay, well, I'll stop it and then I'll just open it again.
Right.
So that's
Friday mood.
Yeah.
New versions of difficulties that we are telling here.
Yeah.
As it happens, Mina, you haven't stopped it yet either, so I don't know what it's showing on your screen, but it's stuck on our screen at the moment on 6, and it hasn't stopped.
6.
Oh, it's gone now. Right, we're back on. Okay. On slide 1 at the moment.
Yes.
Okay, and now it's gone from my own computer. That's strange.
Oh, I can do it. Hang on. I can do it. Right, I'm doing this now. So we're going to 6 out to 7. Right.
Okay.
Okay.
I'm so sorry.
No, I'm sorry.
All right. Somehow I have control. So
My computer had it for the week.
Just tell me, Dan. We're on 7 at the moment. Over back to you.
Okay, I still see slide number 1 to make things difficult.
Me too.
Is it only on my screen then that it's gone up to 7?
Yeah, maybe, because I still see slide number 1.
Right. And no, hasn't moved again. So
Okay,
somehow
this is
I
really
moved
odd.
for me, but not for anyone else. Right.
But funnily enough, I can click on and see the next slide on my screen. I don't know if you can also click on. I have a
see
button,
Teams is
click
failing
on.
us all. My colleague said that their Teams is not working today properly, so it's I think it's the international overload or something.
We can reach the right slide by on our own. I am on 7.
So, okay, so if all of us can click on the slide for ourselves, then we can all move it when you say next slide, please, and tell us the number.
Oh, that's interesting.
That's a good idea.
But I can't. I can't.
But you
No.
can't see it, so you don't know what it is you're seeing. Okay.
You can too. You
Let
can
me
too.
try one more time.
I have a message as well next to the slide which says live sync to presenter slide 2, whatever that means. Oh, it's gone. Right on. It's gone.
And now?
Now it's back. Can you see anything, Diana?
4,
Yes,
Yeah.
5,
yes,
6,
yes.
Yes.
Looks
7.
Yes.
Slide number
Woohoo!
3.
Okay.
Oh, you can.
Oh, wait.
Diana, you're on 3, are you?
I can click myself to the presentation, and I'm on slide 7 now.
Okay, but your clicking doesn't work so glad, but I think Mina will have to click for the rest of us.
Okay.
Anyway, carry
No,
on.
no, I can also see 7.
Okay.
Yeah, but I think Mina's done it to 7.
I did it.
I'm on the 7th slide.
Okay. Maybe I'll just try, and then we'll see if I can skip through 8 sometime. Okay.
Yeah.
So this is these are the elements of the Shift Plus intervention. We were using psychoeducation, of course, and we were also working with worksheets so that they had to write something down. We had role plays, and we also had observation tasks so that the participants were asked to observe the family members' behavior, but they had also self-observation tasks. And there was also, because it was a group intervention, we had also time for discussion and exchanging experiences. And because it was a short-term intervention, we were trying to give them optional homework in order to ensure that they transfer the knowledge to their everyday lives. Okay, I'm now trying to click on slide number 8, which worked for me. I hope for you as well.
No, we're still on 7.
No.
Mina, you click to 8.
Yes.
Yeah. So okay. So
Yeah, okay.
somehow
Okay,
they're completely independent. You do yours, Diana, and Mina does everybody else's.
Okay,
Yeah,
that's
genau.
fine.
Genau,
Okay.
genau.
Okay, works for me. Okay, these are the modules. I'll do it really quick because of the time. The first module is like getting to know introduction module. So they were getting to know each other, getting to know the trainers, exchanging aims and expectations, agreeing on group rules, and establishing trust in this group setting. The second module is about parenting, and it's called Approaching Good Times, for no reason, because it's a very positive, resource-oriented module, and they participants were asked to or welcome to view parenthood positively, not only see the negative sides, but also the positive sides. And they were trying to develop more sensitivity for the needs of their children and to try to fulfill these needs and to foster the parent-child relationship in total. And in module number 3, it's also about parenting, but then it's going to what is happening when times are getting difficult. And they are reflecting their behavior in that module, and they are learning to establish and communicate rules more clearly. And they are trying to manage challenges successfully, and also, this is the main part, non-violently. Okay, I'll go to slide number 9. And number 4 and 5 are our family resilience modules. And the first family resilience module is also a very resource-oriented, positive view on the family. And in this module, the participants become familiar with the concept of family resilience, get to know what is it. And they are learning about the 3 key elements of family resilience. And the first key element is enhancing common optimistic beliefs within the family, like where are we heading to in the next year, for example. And number 5 is the second part of the family resilience module. It's about the other 2 key concepts, which is acknowledging successful rules and procedures in the family. So what is going well already? And how can we get new ideas for promising rules and procedures? How can we ask for help if we need some? And how can we communicate openly and positively, especially with regard to feelings? And how can we improve problem solving? The next module, number 6, is about addiction and the family. And the focus is put on dissolving the taboo of addiction within the family, which is often the case. And the participants are also reflecting the effects of their addiction on the family. And related to that, they're also learning to cope with feelings of guilt. And they're also trying to identify risk factors for relapse inside the family, like fighting with other family members. And they are learning about how the family can help them to stay clean, and how, on the other hand, they can try to improve the family relationships. Going to slide number 10. And module number 7 is the first family module. So this is the first family, the first module where not only the parents are there, but also the children of them. And it's a very easy module, I would say. It's about getting to know the children. It's the children's first contact to the professional help service system. And they are exchanging how can they be more positive inside the family, and how can they develop and reflect on a common family goal, depending on the age. If the children are very small, it's more a playful module. If the children about 6, 7, or 8 are able to write, so the more we could go into the details of the module. Number 8 is a very important one, because drug-involved parents also have relationships which are very unstable and very conflict-ridden. They're always fighting, separating, and so this is very important for them, which was one of our most popular modules. It's about nurturing the partner relationship, identifying conflict potentials within the relationship, coping with fighting and arguments, and reflecting also on common drug use, because this was something they were doing together. And now that abstinence is there, how are we going to spend our free time? And also developing alternatives of spending time together. Module number 9 is another family module. It's with the adult family members. It's also about getting to know each other, learning that it cannot be a group therapy session, but it's more of psychoeducative sessions, getting to know the process of recovery and its relevance to family members, functional handling of the phases of the recovery for all involved, and developing self-care ideas for relatives and using help services.
Officially, you have only 1 minute left.
Oh, okay, that's not much. Okay, I'm going to hurry.
But I think we should extend this a bit, because more than
Yes.
Oh, okay,
yes.
Thank you. But I'll rush. Okay, this is the last module, number 10. It's more of a goodbye and a positive outlook. How can I transfer what I learn into my everyday life, and what can I do in case of relapse or conflict? Okay, this is the method on slide number 12. And this is our research design. Shift Plus was evaluated in a quasi-experimental research design. We had 8 project sites from all over Germany. And we had 2 groups. We had the intervention treatment group, which was receiving Shift Plus immediately after our baseline measurement, and there was also, as a second group, the waitlist control group, which was at the same time a treatment as usual group, which received the training after the third point of measurement. The allocation to one of these two groups was randomized if possible, but it was unfortunately not possible at all project sites. And this is what Janina just said. We were using standardized self-report questionnaires at 4 measurement time points, immediately before the intervention, then after the intervention that the intervention group received. Then we had the first follow-up 3 months later, and also another follow-up 3 months later, but due to the COVID pandemic, this didn't go very well. We only had a third of the participants left at the T4 management. But somehow we were lucky, because at the time of the outbreak of the COVID-19 pandemic in March 2020, the first groups had already ended at 7 of 8 sites. Okay, I'm going to slide number 13. This is something I'm not going to repeat because Janina presented it. Maybe just one word about the gender. We can see we have 1/4 of males, which is pretty much, I think, for parental intervention, because most of them mainly address mothers. So it's not a lot, but we are really happy to have at least 25% males. Yes, number 14. I did not bring any numbers or figures or tables, but a brief summary of our main research findings. And we found that immediately after participation in the Shift Plus parent training, mothers and fathers in an intervention treatment group reported significantly lower depression rates and more knowledge concerning drug use and the family, which was a success. And we also were able to identify long-term effects, which means in this case 3 months post-intervention. And this showed that both groups exhibited significantly less mental health problems, less drug-related problems, and increased confidence in parenting, which is a great success in our view. And the intervention was also highly accepted by both trainers and participants. Slide number 15. This is my discussion slide, and it says that even though the pandemic compromised data collection, especially with regard to long-term effects, our findings indicate that Shift Plus is an intervention that is able to address the specific challenges drug-involved families may experience and to improve their situation. And how do we explain the phenomenon that both groups improved? We think because the treatment as usual group received a treatment as usual, which was quite intensive. They had drug counseling, some of them have psychotherapy, many of them received family help services, and all participants showed great interest in improving the family situation. So they were very motivated. The Shift manual has been published in German already on the mainly about the methamphetamine participants, and the 2 family modules from Shift Plus are available online, unfortunately in German only, which means an English translation for both programs, Shift and Shift Plus, is still pending. So this was my presentation. This is the last slide. Thank you very much for your attention. And I think now Janina and I can be ready for your questions.
Yes, thank you. Thanks a lot, both of you, for your very interesting talks. Some questions came in. Mm-hmm. The first is from Minna from Finland, and she asks if overgenerational trauma comes across in your study, parents who haven't got a parenting model to build on themselves.
Well, I can try to answer the question. It is not a focus of our program, but of course we are aware that most of our participants had a difficult biography and maybe substance-using parents themselves, or have experienced traumatic experiences. And this is something which comes forth in the modules where they talk about the family, but it's not an explicit focus in this case.
Okay, thank you. And Richard asks if the training is not for very young children, say from until 8 years old.
No, that was that's not quite the discussion. The question, which I think originally came from Steve, was: is there an evidence-based intervention for young children? One of the answers was that Steps to Cope is around, but that is mainly for older children. That's based on the 5-step method. So the question is there an intervention that you know of, an evidence-based intervention for younger children? And I see that basically this shift doesn't actually have an intervention either for younger children. Is that right?
Oh, yes, it's exclusive parent training, and we don't know an intervention which is substance specific for younger children than 8 years, at least not in Germany.
Okay, so that sounds like it's a major area in many countries that with substance misusing parents, there's obviously a big impact on younger children, and yet there isn't really an intervention. Steve also asked a question about, in your data, was there any impact? Did the parents report any impact on their children of your SHIFT program?
Janina, do you want to answer that? Because you know the results better than me.
Yeah, of course. I'm going to add two things, talking about the first intervention for younger children. From the experience we had in this training, where we had a module for children included, we see that children younger than 8 or preschool age, they are there's a large variability in this group depending where you start the age. But a child that is 4 and a child that is 7, there's huge developmental steps. So it's very difficult to, I think, to build a concept for a bigger age group before preschool. So that's why we targeted the parents primarily. And with regard to the situation of children, if it improved, yes, I know the data on that, and I know that both groups improved here in terms of externalizing problems for the direct post measurement, and they improved with the overall problems as well as conduct or externalization with the third measurement, and also reported reduced social problems at the third measurement. But here we're not sure if this is pandemic related, because when we had our third measurement, the lockdown, our first lockdown, was over, and we assumed there was a lot of social impairment in children. So we assume that the reduction of social problems is due to the end of the lockdown.
Thank you. Yes, indeed, the pandemic and the closing and opening of society obviously has a huge interfering effect on how we interpret our data. A number of people have come up with, on the chat room, by the way, with saying that there are 1 or 2 interventions for younger children. From Holland and Ed from Ireland have both talked about them. If there is time, Doreen, I just wanted to ask one question about your treatment as usual findings, which I suppose is, if I wanted to play devil's advocate, I would be saying, well, haven't you demonstrated that there's absolutely no need for SHIFT? That actually, that if you give whatever is treatment as usual, people improve just as much? Or is the treatment as usual very unusual?
Diana, willst du, soll ich? Mir ist egal.
Oh, maybe you can start. Maybe you can join later because you know the results better.
Well, yeah. Well, first of all, I think, yeah, I get the question, and of course, you could say that, well, what we see is treatment as usual is effective, of course, and it helps apparently also parents with drug abuse. But on the other hand, it is also a matter of focusing exactly on the issue of parenting within substance use. I guess that is what we want to promote through this intervention, is that parents, that mothers and fathers, or women and men who are mothers and fathers are recognized in a role as a parent, and also offered adequate support. And we do not see shift as we see it as an add-on to their standard treatment. But of course, you could say there's a lot of family services that we might be able to reduce if we have a group intervention, and therefore have an economic setting for these parents in Germany, and might be able to reduce individual help, and then implement shift in another setting. But of course, we cannot do that in our research project for ethical reasons. We cannot say, okay, you don't get any family services anymore and you get shift, because we don't have an evidence base.
I think what is very crucial in this, it's not only the treatment as usual, but it's also the selection effects we had, because all the parents that were joining our program, that they were really motivated to improve the family situation, and they were trying to seek help for their children. And in many drug-involved families, this is not the case. So I think this is maybe even stronger responsible for the results that even as much as the treatment as usual.
Thank you.
Thank you. There's one question left from Ed Zippler. He asks if parents' own emotional regulation was an area in any of the models.
Yes. We did not have a specific module for emotion regulation, but I think the topic was integrated in most of them, because in the module we were talking about how to improve parenting, that they just learn not to flip out and not to behave violently, but to stay calm, take a few breaths, get out. And this was also the case in the relationship module. So when it's about how do I fight with my partner? Am I happy with that, or do I need to improve? So I think this is an integral part of it.
Okay. I have a question of my own for both of you, I think, about recruitment. In the Netherlands, we hear from treatment providers in addiction care that they are reluctant to discuss parenting, because they are afraid that people will withdraw from treatment. Do you recognize that in Germany?
Yes, especially if the youth welfare services are involved, because it's always the idea, okay, if I open up myself about my substance use issues, my child gets taken away from me immediately. And this is why we found that recruitment via substance use abuse facility was easier, because it was clear the parents are using substances, and they have children, and of course some of them might be reluctant, but some of them also were relieved, because it's an important topic. But it's easier to recruit via this instead of youth welfare services.
Okay, thank you. I think we're out of questions.
More important,
yes.
We're out of time.
We're out of time, that's true. That's true. So,
do you want to sum up, Doreen, and then we'll come back to Gallus and myself to finish the conference?
Yes, well, thanks a lot, Diana and Janina, and over to Gallus and Richard for their closing words.